Good afternoon. So, when I was a little girl, I remember going to the doctor with my grandmother. And she was going to see her doctor for a checkup. And this was a long time ago. I'm 52, so I was really little. You can think this was probably 40, 45 years ago. And we just drove basically down the street and around the corner from our city home, where I still live today. I'm living in my grandparents' home, my mother's home. It came down through the generations. So we drove to the doctor's office, and his office was actually in a building where he lived upstairs with his wife and his family, and his practice was downstairs in the city, a row home. And I remember my grandmother getting her checkup and getting a prescription filled and handing the doctor $20, or his secretary, who happened to be, I think, his wife. And my grandmother handed her $20, and that was it. And we went to the drugstore, and she got her prescription filled, and she handed the drugstore clerk $25 or $20 for her prescription, and that was it. And we came home. Isn't that cool? Cash and carry healthcare. She didn't have to root through her purse and look for an insurance card and go to the billing department and have all this stuff and then go to the pharmacy and give her ID and give an insurance card and wait to make sure the insurance approved anything. She just paid the man cash. And by the way, this doctor, Dr. Rubin, he was a good doctor. My grandmother lived to be 75 years old, and she had severe diabetes, horrible arthritis and bone spurs on her back. And with this doctor being her doctor her entire life, what actually killed my grandmother was an aneurysm to her brain, which anybody can get, and most doctors cannot prevent. So paying the $20 per office visit and filling a couple prescriptions at a very low cost and cash and carry, my grandmother lived a pretty long life. And she got diagnosed with diabetes when she was in her early 50s, I think, by Dr. Rubin, a doctor who, again, did not live in a big mansion or have summer homes or drive fancy cars or have a pool in his backyard or a tennis court in his backyard. He lived where his patients lived. And he even made house calls. And he was a great doctor. What has changed? Find me one doctor who lives in my city right now, who lives in my neighborhood. Find me a doctor who makes house calls. Find me a doctor who charges a patient $25 for an office visit. Find me a pharmacy that charges $20 for a prescription. Bet you can't find me one. And I'm talking with no insurance. But what I am talking about is because of everything that's happened with Obamacare and that huge failure, and the failure of healthcare in our country totally. The fact that health insurance companies have actually taken over healthcare. They decide. A health insurance company, somebody on the end of the phone you've never met, decides you can go see this doctor, or you can go get this test, or you can get this surgery, or you can get this prescription. Somebody who never met you is making those decisions. And somebody at your doctor's office is being paid to deal with those strangers, the strangers who are choosing what kind of health care you can get. Because they're saying, we will pay for this or we won't pay for this. And if they won't pay for it, most of the time you say, well, then I can't get it. And your own doctor may say, well, I can't prescribe this for you because your insurance won't cover it. I've been told that, by the way. I was told when I was in my mid-40s that I should get an osteoporosis test, a bone density test. But because my doctor knew my insurance wouldn't pay for it, he said, well, insurance isn't going to cover it. And I know you're not going to want to pay for it, so I'm not going to suggest you get it. But you need it. You should have it, but your insurance won't cover it. Now, if there was no insurance where I was paying premiums, and say the bone density test costs $200 and I wasn't paying $500 a month for healthcare premiums, maybe I could afford the $200 for a bone density test to make sure my bones are healthy. Maybe. Or I could choose to not spend the $200, but at least I would have a choice. And this is what's happening in some parts of our country. And my friend Dane on Facebook, he posted this on his timeline. There are cash and carry hospitals. They are no frills, no fuss. You will not see a suite as a hospital room. You will not get a flat screen television with 500 channels and a DVD player with videos to watch and video games to play for your visitors. You will find the bare bones treatment. You will get well when you go to this hospital. What you won't get is a baby grand piano in the lobby, a fancy gift shop selling, books and magazines at triple the price. You won't get a fancy cafeteria with a chef making 4-star meals. You will get your health care. And you will get it at 60% cheaper. And you won't need insurance. You will not need insurance. You go in, you say, hey, I'm here for my gallbladder surgery. Well, it's nice to see you. Let's get you prepped. We're going to give you the surgery. You'll be out of here in about 5 or 6 hours. That's going to be $1,300. There you go. There's the check. And 5 hours later, you're at home recovering, watching your cable TV that you pay for in your home. And my dog is chiming in. Hi, Savvy. I know, it's the mailman. Savvy says hello. Savvy has better health care than any of us, by the way. Savvy, come on. It's live TV. I'm like that dude over in wherever where his kids came into the room. Only my husband didn't run down and slide through the room and pull the dog away. But, Savvy, Mommy's live here. But the bottom line is, we should not be going to the hospital for a hotel visit. And if you look at your bill when you go in for surgery, even day surgery, the most expensive part of your bill is the time you spend in that recovery room with the flat screen that you are knocked out. But your family and friends who are sitting with you waiting for you to wake up, they get to watch HBO and Showtime and Cinemax and play video games and sit in lazy boy $5,000 chairs, and they can blow their nose on $12 tissues, boxes of tissues, and if they need an aspirin, they can pay $15 for an aspirin. But all these bells and whistles for one day in the hospital, because God forbid someone should go to the hospital for day surgery and not be able to catch up on Game of Thrones while they're waking up from anesthesia, or their family and friends come to see them while they're waking up from their day surgery and not be able to watch television, all their favorite channels. This is what's wrong with healthcare in America. It's all these bells and whistles where you are charged the equivalent of a vacation hotel, a vacation resort, for one night in the hospital. The anesthesiologist and the surgeon charge something. They charge a lot. But your main bill is that hospital room. God help you. If you are in the hospital overnight, that room is going to cost you more than a Caribbean resort hotel room costs per night. About $4,000 a night. To basically lay in the bed and recover from surgery. Now, the cash and carry hospitals, they don't have that. But what they do have is great care, because the doctors are there because they care. And the hospitals on these cash and carries, most of them are run by doctors. By people who actually see and know patients. Not by these big administrators that some of these hospitals are run by now. These big monopoly conglomerate hospitals like I have in my town. Where the administrators aren't even doctors and they have never seen a patient. They have never been in an operating room, but they make millions of dollars a year on the backs of their patients. on their patients' illnesses. And this is the other reason why the cost of healthcare at these hospitals is so much more expensive than the cash and carry hospital. And billing departments, well, you can get rid of a billing department at a cash and carry hospital. You don't have to pay someone and train them to understand all the health insurance codes and we won't pay for this and that deductible isn't met and blah, blah, blah. You don't need those people. They can go work for the fancy hospitals with the grand pianos and the flat screen TVs. A cash and carry hospital only needs one thing. Two things. Great doctors, great nurses who care about patients. They care about patients and patient care, and that's all they care about. They're not providing free cable. They're not a cable television provider. They are not an internet provider. They are providing health care, and that's all they're providing. And they are doing it at 60% less. So if you don't have insurance, guess what? You can walk into a cash and carry hospital and get a colonoscopy. And it's not going to cost you the $2,500 to $3,000 it costs you at a fancy hospital, where spending 6 hours in that hospital is going to cost you $3,000 for 6 hours of your time. They may charge you $1,000. They might even charge you $800 because you're going in, you're getting the tube shoved up your butt, and you're leaving as soon as you wake up. You're not going to be watching TV. You're just going to be getting your colonoscopy, which is the whole point of going to the hospital in the first place. And if you're going to the hospital to watch free cable, then you have a problem, my friend. So these cash and carry hospitals are able to do things the way they're supposed to be done, the way my grandmother's generation had it done. You go to the doctor when you're sick. You go to the doctor to get well. You go to the hospital for surgery. You go to the hospital for surgery. You wake up from surgery, you recover, and you go home. You don't go to the hospital for gourmet-style food. You don't go to the hospital to watch television. You go to the hospital for health care. It's not a vacation. And these hospitals that have changed into resort-style rooms with baby grand pianos in the lobby that nobody, when you're at the hospital visiting someone who's sick, I don't think you really want to listen to someone playing a baby grand piano. That's not the top of your list. You don't have time to stop and sit in the lobby and listen to the piano. You're worried about your loved one. You're worried that the doctors don't kill your loved one with malpractice, which happens daily in this country. Mostly from these big, mega conglomerate monopoly hospitals. They kill a lot of people with malpractice because they care more about the baby grand piano and paying their cable bill than they do about paying qualified doctors and punishing bad doctors and getting rid of them. They care more about firing anyone who smokes, even on their own time, good doctors and nurses, and they keep the bad ones who will do a surgery drunk on martinis. They'll keep them. But if you dare smoke a cigarette and you work at one of these hospitals, you're fired, even if you smoke on your own time. But you have a couple martinis, you come in for emergency surgery, you kill somebody, they'll keep you on, they'll protect you. They got your butt. Cash and carry hospitals are the way to go. Hospitals run by doctors, controlled by doctors, not insurance companies, and with the patient always in mind. The patient. Not the people coming to visit the patient. Well, what are the visitors going to do? Sit there and twiddle their thumbs? Yeah. My grandmother was in the hospital a lot when I was a kid, and I remember what we used to do. We used to sit in the waiting room, play cards, twiddle our thumbs, and order pizza. Or bring in pizza. There was no cafeteria back then. And there was also no insurance company charging my grandmother $1,500 a month with a $7,500 a year deductible. No, there wasn't. I know, I was there. We just sat in the room, played cards, waited for information on how my grandma was doing. And if we wanted food, somebody would bring food in. That's good old school hospitals. It's about the patient. And it is not a vacation spot. It is not a resort, like many hospitals now think they need to be. So I think we should think about that when we talk about healthcare reform and start talking about competitive pricing. You know, if I go to one hospital and I need my gallbladder, I should say, well, what do you charge for gallbladder surgery? And they tell me, and then I say, well, I'm going to go to the other hospital and see what they're going to charge. Is that all? Is that the best you can do for me? I'm going to write you a check in cash right now. I don't have insurance. We're not dealing with insurance here. This is you and me, fascia e fascia. This is how much I think the surgery is worth. Now, what can you do for me? I bet I will find a hospital somewhere that will do my gallbladder surgery at a price that I think is fair. And if more hospitals start being competitive with each other, instead of worrying about what insurance is going to pay, I bet we see prices go down. I bet we see that we start paying as patients for real health care and not the inflated health care that doctors have to submit to health insurance companies because the health insurance companies are going to jack them down and say, well, you charge $500 for this, we're only going to pay $250. I'm coming in as the patient saying, you don't need to worry about insurance. You don't need to hire someone to go through the insurance. I will pay you the $250. Because I've already just saved $15,000 not having health insurance. I've got some money to play with. So think about what I just said about the cash and carry. They already have cash and carry hospitals in several states in our country. And they are doing very well. They are busy. And if you're a doctor out there listening to me right now who really cares about their patients, you care more about your patients than you do about your status, your country club membership, the kind of car you drive, the kind of house you live in. If you care about your patients, think about getting a group of other doctors like you to open a medical practice or a hospital like this. Cash and carry. No frills. No flat screens, no cable, no internet, no babygram mechanics. And get the best doctors and nurses. Don't worry if they smoke a couple cigarettes on their own time. Don't worry about it. Get the best. People who care about their patients, because this is what this is about. It's about the patient. It is not about health insurance companies. It is not about Donald Trump. It is not about Paul Ryan. It's about people like you and me. And me especially now, since I am uninsured. Because I refuse to buy an insurance policy that I know I will never use in a year. I won't get what I'm paying for. I won't get what I'm paying for. And I won't buy any product that I can't use. And that is the problem with health insurance. So it's just an idea. My friend Dane, thank you for posting that. I think it's a fantastic idea. I believe this hospital was in Ohio. If I'm wrong, I'm sure someone will correct me. But it's doing very well. And the people who live around this hospital love it. They love being able to go in and say, how much is this going to cost? Okay, let's do it. Pay, done. Nobody wants to spend more time in the hospital than they need to. So for hospitals to try to make hospital rooms at $5,000 a pop a night, some kind of hotel experience, is ridiculous. The whole point is get in, get well, get out. Go home and sit on your own sofa, your own lazy boy that you paid for, and watch your own cable and use your own internet. You go to the hospital to get well, not to get pampered. Political Paula, out.